And a recent CDC report finds 1 in 14 Americans has had or is still battling long COVID. But according to a story first reported in the Washington Post, getting a diagnosis or even help can be challenging, particularly for people of color. GMA anchor Michael Strahan has that story.
Early in the pandemic, Jasmine Holcomb got a bad case of COVID and wasn't able to breathe on her own.
They told my mom it's time for her to go on the vent, and there weren't any other options at that time.
For 2 months, the 28-year-old from Baltimore lay on a ventilator in a medically induced coma.
One hand on the...
Miraculously, she pulled through.
1, 2.
Yeah.
Good. But she had to relearn how to walk, how to talk, and how to deal with the chronic condition known as long COVID.
Long COVID is when there are any sort of signs or symptoms or any sort of conditions that start after a COVID-19 infection and then persist onwards.
Long COVID occurs in 10% of all COVID infections, and more than 200 symptoms have been associated with the disorder, from gastrointestinal problems to changes in blood pressure and heart rhythm.
The most severe long COVID patients that I have right now are homebound.
While long COVID can happen to anyone, most diagnoses are in women aged 36 to 50. People in the prime of their lives, like Janine Hayes, a New Yorker diagnosed in 2021 at age 42.
I want people to know that we're not making up our symptoms, that we have real complex issues, and that it is extremely hard if you're African American, because you come in with complicated issues into a healthcare system that is not designed to meet our needs.
Studies show that Black and Hispanic Americans may experience more health problems related to long COVID compared to their white counterparts, but are less likely to be diagnosed and get proper care.
Communities of color and underrepresented communities have difficulties with access to care. They're underinsured, they're uninsured. So that first big barrier of even encountering a physician that suspects long COVID that will refer them doesn't happen.
Medical bias is also an issue. Before her long COVID diagnosis, Janine says she went to an allergist for her hives and said the doctor, who was white, diagnosed her with herpes.
I was like, I just don't think it's anything like that. And she just kind of rushed me out. Like there was just really nothing to it. I can't believe that this appointment we had waited for and the outcome was being dismissed, really not feeling like I was heard in any way at all.
Janine says she ultimately found excellent doctors. Jasmine says she was fortunate to have her mom, a former ICU nurse, advocate for her in the hospital when she couldn't speak for herself.
I was able to have a good advocate on my side for a lot of these things, which in general, most people don't have, let alone people of color.
But hospitals across the country are trying to address issues of bias and access to care for minority populations.
There's a conscious effort from the advocacy groups for long COVID to make those voices heard, which I think it's incredibly important.
Mount Sinai Hospital is addressing this problem by expanding their Center for Post-COVID Care into the hardest hit areas of New York City, East Harlem, and the Bronx.
The reality is that there's a lot of undiagnosed patients out there and so many patients who just don't realize that all of this is happening and linked to their COVID infection and that there's options available to help them feel better.
Michael Strahan, thank you. And ABC News medical contributor Dr. Alok Patel joins me now for more on that. Dr. Patel, what are some of the symptoms of long COVID and what can people do if they think they are suffering from it?
Dan, these symptoms can range from post-exertional fatigue. That's a fancy way for saying that after you go and exercise or walk around, all of a sudden you feel very tired. It's hard completing tasks, to dizziness, loss of balance, issues with sleep, your heart racing, basically can affect your organs from head to toe, which is why this recent report from the National Academies of Sciences listed out over 200 symptoms that can affect people. And what makes this really difficult is that it requires an individualized approach. No two patients are necessarily the same, and there isn't necessarily a test, a blood test, or a biological marker that can say, yes, you have long COVID. It really comes down to this broad list of categories to get someone a diagnosis. So what people should do, first of all, don't self-gaslight. Realize that your situation and your symptoms are real, and go and talk to a healthcare professional who actually listens to you. And in your area, they may actually be a long COVID clinic, which is another important resource to seek out.
Patel, what advice do you have for patients who feel that they're the victim of medical bias? How can you advocate for yourself to get the care you need when the people responsible for that care don't seem to believe you?
And this is unfortunately not a new scenario in medicine. Medical bias, racism in care, and inequity in who is actually able to reach services is something that is that's held throughout our American healthcare system. We saw this in a grand scale during COVID in early 2020. We see this playing out right now in long COVID. I think having an advocate is a privilege, is extremely important. If you can bring someone with you, whether that is a coworker, a family member, a friend, a community leader, anyone to speak on your behalf as well, talk to clinics and find out if that clinic can understand and talk to people of your socioeconomic, your cultural, your linguistic background. And I think it really does start in you understanding your own symptoms. Diane, I was reading comments online recently from long COVID sufferers who feel really heard from this recent report, talking about these symptoms and saying, yes, what we're going through is real. Our lives are affected. And people still kind of question their own symptoms. So it's important that you keep a journal, you understand what you're going through, you understand it's real, that it's affecting you, and get someone to speak on your behalf as well. You can ask around. There's also support groups where people may be able to help you.
All right, medical contributor Dr. Alok Patel, thank you.